Hello students, welcome back to my channel Nursing Guru 24. Today we will discuss about an endocrine disorder. Endocrine disorder, that is Cushing's syndrome. Cushing's syndrome. Before proceeding with this disorder, first we will see brief anatomy of urinary system. As we all know, human urinary system is consisting of two bean-shaped organs. They are kidneys, then two ureters, then one urinary bladder and one urethra. Just above each kidney, there are two triangle-shaped glands. They are called as adrenal glands. They are adrenal glands. Adrenal glands are the glands located just above each kidney. Just above each kidney. Hence, they are also called as suprarenal glands. Suprarenal gland. Supra means above. Renal means kidney. The glands which are located above the kidneys are called as suprarenal glands. The main function of these adrenal glands is to secrete cortisol, aldosterone, adrenaline, and noradrenaline. Adrenaline is also called as epinephrine. Noradrenaline is also called as norepinephrine. Adrenal glands are responsible for production of cortisol, aldosterone, adrenaline, and noradrenaline. Cortisol is an steroid hormone and also stress hormone. Cortisol is the stress hormone. The release of cortisol is regulated by hypothalamus, adrenal glands, and pituitary gland. Adrenal glands, hypothalamus, and pituitary gland are responsible for production of cortisol. What is the normal level of cortisol? Normal level of cortisol secretion in human body per day is 50 to 100 micrograms per day. Daily 50 to 100 micrograms per day. This is the level of cortisol secreted by adrenal glands, and this regulation is regulated by hypothalamus, adrenal glands, and pituitary gland. There are some reasons which causes increase in the level of cortisol. There are some causes, they leads to increase or rise in the level of cortisol. If there is rise in the level of cortisol in body, then that condition is called as Cushing's syndrome. Cushing's syndrome is a disorder where there will be increase in the level of cortisol. How much? That will be more than 100 micrograms per day. Right? The normal level of cortisol is 50 to 100 micrograms per day. If this secretion is more than 100 micrograms per day, then that condition is called as Cushing's syndrome. That is also called as hypercortisolism. Hyper refers to increased levels. Cortisolism means increased level of cortisol. Hence it is also called as hypercortisolism. Next, we will see the causes of Cushing syndrome. Cushing syndrome is mainly caused by two main causes. They are steroid medications. Second major cause is tumors or neoplasms. Cushing syndrome is caused by prolonged use of corticosteroid medications. Already cortisol is releasing in the body. Along with that, if you are taking corticosteroid medications regularly or for the prolonged time, it causes increase in the level of cortisol. Taking more steroid medications may cause Cushing syndrome or some tumors or neoplasms in adrenal glands or pituitary gland or hypothalamus. Neoplasm means growth of some new tumors. Growth of such tumors in adrenal glands or pituitary glands or hypothalamus may also increase the level of cortisol that leads to Cushing syndrome. Cushing syndrome caused by medications is called as exogenous Cushing syndrome. Cushing syndrome caused by prolonged use of corticosteroid medications is called as exogenous Cushing syndrome. Cushing syndrome, which is caused by tumors or any other neoplasms, is called as endogenous Cushing syndrome. Steroid medications and tumors are the causes for Cushing syndrome. Next, we will see symptoms of Cushing syndrome. Symptoms of Cushing syndrome. CUSHINGOID. CUSHINGOID. CUSHINGOID is the mnemonic used for describing the symptoms of Cushing syndrome. CUSHINGOID is the short form or mnemonic used for describing the symptoms of Cushing syndrome. Here, each letter stands with some symptom. Here, C stands for central obesity. Or cataract. U stands for ulcer, usually peptic ulcers. S stands for striae. Striae means strips over the body. Then H stands for hypertension. I stands for infections. N stands for neoplasms. And G stands for growth retardation. Then O stands for osteoporosis. I stands for increased ICP, intracranial pressure. Then D stands for diabetes mellitus. This is the mnemonic used for describing the symptoms of Cushing syndrome. C stands for central obesity or cataract. The U stands for peptic ulcers. S stands for striae. Striae are the strips. They appear over the abdomen. Then hypertension, infections. N stands for neoplasms, growth retardation, osteoporosis. Then increased intracranial pressure and diabetes mellitus. These are the major signs and symptoms of Cushing's syndrome. Next, the management of Cushing's syndrome. Management of Cushing's syndrome. Management of Cushing's syndrome depends on the underlying cause, whether medications are causing higher levels of cortisol or any other tumors are causing increased level of cortisol. First one, if it is due to exogenous cause. If the Cushing syndrome is due to exogenous means medications, taking prolonged corticosteroid medications. If that cause is causing Cushing syndrome, then management includes some medications for lowering cortisol level. The medications which cause or which decrease the level of cortisol level are ketoconazole, or levoketoconazole, or mitotane. Mitotane, ketoconazole, or levoketoconazole are the examples for medications for reducing the level of cortisol. If Cushing syndrome is caused by medications, corticosteroid medications. If the cause is endogenous or tumors, then the management includes surgical removal of tumors. Example, adrenalectomy, surgical removal of adrenal glands or surgical removal of tumors in adrenal glands, adrenalectomy, or radiation therapy as secondary treatment. This is the management of Cushing syndrome. Management of Cushing syndrome depends upon the underlying cause. If it is caused by exogenous causes or corticosteroid medication, some medications are given to reduce the level of cortisol. Examples include ketoconazole or levoketoconazole or mitotane. If Cushing syndrome is due to tumors or endogenous causes, then there are no other options. That includes surgical removal of tumors or radiation therapy as secondary management. This is brief about Cushing syndrome. If you have any doubts, please ask in comment box, and if you like this video, please like, share and subscribe my channel. Thank you.